Lab tests, those sheets of numbers and abbreviations that your doctor hands you after a checkup, can seem like a foreign language. Yet, these tests provide valuable insights into your health and are crucial for making informed decisions about your well-being. But how do you make sense of it all? Welcome back to Health Square, the podcast where we break down essential health topics to help you make informed decisions about your well-being. I'm Bills, and today we're diving into a topic that can seem a bit overwhelming: lab tests. Whether it's a routine blood test or a more specific diagnostic test, understanding what these tests measure and how to interpret your results can give you valuable insights into your health. In this episode, we'll explore some of the most common lab tests, what they indicate, and how to make sense of your lab report, with plenty of examples and anecdotes to make everything crystal clear. Let's start with a story about my friend Rachel. Rachel recently went for her annual checkup and was handed a lab report full of numbers and abbreviations that she didn't quite understand. She was concerned about some of the results and wasn't sure what they meant for her health. After talking with her doctor and doing some research, Rachel learned how to interpret her lab report and what each test indicated about her health. This experience empowered her to take a more active role in managing her well-being. Complete blood count (CBC), what it measures and why it matters. One of the most common lab tests is the complete blood count, or CBC. This test measures the levels of different components in your blood, including red blood cells, white blood cells, hemoglobin, hematocrit, and platelets. Each of these components plays a crucial role in your overall health. Red blood cells, RBCs, are responsible for carrying oxygen from your lungs to the rest of your body. If your RBC count is low, it could indicate anemia, which can cause fatigue and weakness. Rachel's CBC showed a slightly lower than normal RBC count, which explained why she had been feeling more tired than usual. Her doctor recommended increasing her iron intake to help boost her red blood cell production. Similarly, my neighbor Carol noticed she was feeling unusually short of breath and tired after simple activities like walking up the stairs. Her lab results showed low RBCs, which led to a diagnosis of anemia related to her diet. White blood cells, WBCs, are part of your immune system and help fight infections. A high WBC count could indicate an infection, inflammation, or even leukemia, while a low WBC count might suggest a weakened immune system or a bone marrow disorder. Mike, who had been feeling under the weather, saw a spike in his WBC count, which indicated that his body was fighting off an infection. His doctor prescribed antibiotics, and his symptoms improved within a few days. In contrast, my friend Jake was alarmed when his WBC count came back low during a routine checkup. After further testing, his doctor determined that it was due to a temporary drop caused by a recent viral infection, and his levels returned to normal on their own. Hemoglobin is the protein in red blood cells that carries oxygen. Low hemoglobin levels are a sign of anemia, while high levels might indicate dehydration or a bone marrow disorder. Rachel's slightly low hemoglobin level was another indicator of her mild anemia, reinforcing the need for dietary changes. My cousin Anna, who is an athlete, had high hemoglobin levels, which initially concerned her doctor. However, it turned out that her levels were elevated due to her intense training and not due to any underlying health issue. Hematocrit measures the proportion of your blood that is made up of red blood cells. It's another indicator of anemia or dehydration. A high hematocrit level can also suggest polycythemia vera, a condition where your body produces too many red blood cells. Rachel's hematocrit level was within the normal range, providing her with some reassurance that her anemia was mild. On the other hand, Carol's hematocrit was slightly elevated during a particularly hot summer when she wasn't drinking enough water, indicating mild dehydration. Platelets are cell fragments that help your blood clot. A low platelet count, known as thrombocytopenia, can lead to excessive bleeding, while a high count, called thrombocytosis, can increase the risk of blood clots. Mike's CBC showed a normal platelet count, which meant his blood clotting function was in good shape. My aunt, however, discovered she had thrombocytopenia after noticing she was bruising easily and experiencing frequent nosebleeds. Her doctor ran a CBC, and the low platelet count led to further testing, revealing an autoimmune condition affecting her platelet production. Basic Metabolic Panel. What it tells you about your body's chemistry. The Basic Metabolic Panel, BMP, is another common test that provides important information about your body's metabolism, including your blood sugar levels, kidney function, and electrolyte balance. This panel includes several key measurements. Glucose is your blood sugar level and an important indicator of how well your body is managing blood sugar. High glucose levels can suggest diabetes or prediabetes, while low levels might indicate hypoglycemia. Rachel's glucose level was within the normal range, which reassured her that she wasn't at risk for diabetes. My friend Jake wasn't so lucky. His glucose levels were higher than normal, leading to a diagnosis of prediabetes. This prompted him to make significant changes to his diet and exercise routine, which helped bring his glucose levels back to a healthier range. Calcium is essential for healthy bones and teeth, as well as for muscle function, nerve signaling, and blood clotting. Abnormal calcium levels can indicate issues with your bones, kidneys, or parathyroid glands. My neighbor Carol, who has osteoporosis, regularly monitors her calcium levels to ensure they're within a healthy range. When her calcium levels dropped below normal, her doctor adjusted her supplements and dietary intake to prevent further bone loss. Sodium, potassium, and chloride are electrolytes that help regulate your body's fluid balance, muscle function, and nerve signals. Abnormal levels of these electrolytes can indicate dehydration, kidney disease, or other conditions affecting your body's fluid balance. Mike, who was recently dehydrated after a bout of stomach flu, saw a temporary drop in his sodium levels, which normalized after he rehydrated. Rachel's mother, who has chronic kidney disease, often has her potassium levels monitored because high levels can be dangerous and lead to heart problems. BUN, blood urea nitrogen, and creatinine are waste products filtered out of your blood by your kidneys. Elevated levels of these substances can indicate kidney dysfunction or dehydration. Rachel's BUN and creatinine levels were normal, which meant her kidneys were functioning well. However, my uncle, who has been managing diabetes for years, had slightly elevated creatinine levels, signaling the early stages of kidney impairment. His doctor recommended lifestyle adjustments and closer monitoring to protect his kidney health. Lipid Panel, assessing your heart health. A lipid panel is a blood test that measures the levels of cholesterol and triglycerides in your blood. This test is crucial for assessing your risk of heart disease. Total cholesterol measures the overall amount of cholesterol in your blood. High levels of total cholesterol can increase your risk of heart disease and stroke. Rachel's lipid panel showed that her total cholesterol was slightly elevated, which prompted her to make some dietary changes to reduce her intake of saturated fats. My father, who has a family history of heart disease, saw his total cholesterol rise as he aged. With the guidance of his doctor, he started a statin medication to help lower his cholesterol and reduce his risk of heart complications. LDL, low-density lipoprotein, cholesterol is often referred to as bad cholesterol because it can build up in the walls of your arteries, leading to atherosclerosis. High LDL levels increase your risk of heart disease. Rachel's LDL cholesterol was also slightly high, which reinforced the need for her to improve her diet. My friend Mike, who enjoys fast food a bit too often, found his LDL levels were dangerously high. He had to overhaul his eating habits, incorporating more fiber-rich foods and cutting back on processed foods to bring his LDL down. HDL, high-density lipoprotein, cholesterol is known as good cholesterol because it helps remove excess cholesterol from your bloodstream. Higher levels of HDL are associated with a lower risk of heart disease. Mike, who exercises regularly, had a high HDL level, which was a positive sign for his heart health. Conversely, Rachel's HDL was on the lower end, so her doctor encouraged her to engage in more physical activity and consider healthy fats like those found in avocados and nuts to boost her HDL levels. Triglycerides are a type of fat found in your blood. High levels of triglycerides can also increase your risk of heart disease, especially when combined with high LDL cholesterol or low HDL cholesterol. Rachel's triglyceride levels were within the normal range, which was a relief, but she still needed to address her cholesterol levels. My cousin Anna, who had been indulging in sweets and high-carb snacks, found her triglycerides were elevated. Her doctor advised her to reduce sugar intake and increase physical activity, which helped bring her levels back to normal. Liver function tests, monitoring your liver health. Liver function tests, LFTs, are a group of tests that measure different enzymes, proteins, and substances produced by the liver. These tests help assess how well your liver is functioning. Alt-alanine aminotransferase and AST, aspartate aminotransferase, are enzymes found in your liver. High levels of these enzymes can indicate liver damage or inflammation, often due to conditions like hepatitis or alcohol use. My friend Jake, who had been taking a medication known to affect the liver, had his ALT and AST levels checked regularly. His doctor advised him to continue monitoring these levels to ensure his liver was handling the medication well. My aunt, who had a history of heavy alcohol use, discovered elevated ALT and AST levels during a routine checkup. Her doctor worked with her on a plan to reduce her alcohol consumption and improve her liver health, which led to a significant improvement in her enzyme levels over time. ALP, alkaline phosphatase, is another enzyme related to the liver, bile ducts, and bones. Elevated ALP levels can indicate liver or bone disease. Rachel's ALP level was normal, indicating that her liver and bones were in good health. My neighbor Carol, who has osteoporosis, also monitors her ALP levels as part of her bone health management plan. Bilirubin is a substance produced during the normal breakdown of red blood cells. It's processed by the liver and excreted in bile. High bilirubin levels can cause jaundice and may indicate liver disease or bile duct obstruction. Mike's bilirubin level was slightly elevated, which his doctor attributed to a mild liver condition that needed monitoring but wasn't causing any serious issues at the time. My cousin, who had hepatitis as a child, experienced a significant increase in bilirubin during a flare-up, leading to a noticeable yellowing of her skin and eyes. Fortunately, with prompt treatment, her bilirubin levels returned to normal. Albumin and total protein levels reflect your liver's ability to produce proteins that are vital for maintaining fluid balance and other bodily functions. Low levels can indicate liver disease or malnutrition. Rachel's albumin and total protein levels were normal, suggesting her liver was functioning well and her nutritional intake was adequate. My uncle, however, who had been losing weight unintentionally, found his albumin levels were low, indicating he wasn't getting enough protein in his diet. His doctor helped him develop a meal plan to increase his protein intake, which improved his overall health. Thyroid function tests, assessing your thyroid health. Thyroid function tests measure how well your thyroid gland is working. The thyroid gland produces hormones that regulate your metabolism, energy levels, and overall growth and development. TSH, thyroid stimulating hormone, is produced by the pituitary gland and stimulates the thyroid gland to produce thyroid hormones. High TSH levels can indicate hypothyroidism, an underactive thyroid, while low levels may suggest hyperthyroidism, an overactive thyroid. Rachel's TSH level was slightly elevated, which prompted her doctor to check her thyroid function more closely. My friend Mike had been feeling sluggish and gaining weight, so his doctor ordered a TSH test, which confirmed he had hypothyroidism. He started on thyroid medication, which helped regulate his hormone levels and improved his symptoms. T4, thyroxine, and T3, triiodothyronine, are the main hormones produced by the thyroid gland. These hormones regulate metabolism and energy levels. Abnormal T4 or T3 levels can indicate thyroid disease. Rachel's T4 and T3 levels were within the normal range, but her doctor decided to monitor her thyroid function over time to ensure it remained stable. My cousin Anna, who was experiencing symptoms of anxiety and weight loss, found her T3 levels were elevated, indicating hyperthyroidism. Her doctor recommended a treatment plan to manage her thyroid hormone levels and alleviate her symptoms. Urinalysis, what your urine can reveal about your health. Urinalysis is a common test that examines the content of your urine. It can help detect a wide range of conditions, from urinary tract infections, UTIs, to kidney disease and diabetes. Color and appearance of urine can indicate hydration levels and the presence of substances like blood or pus. Rachel's urine was clear and light yellow, indicating good hydration and no immediate concerns. My aunt, who had been experiencing pain during urination, noticed her urine was cloudy. Her urinalysis confirmed a UTI, which was quickly treated with antibiotics. Protein in the urine, proteinuria, can be a sign of kidney disease or other conditions affecting the kidneys. Mike's urinalysis showed a small amount of protein, which his doctor said might be related to mild kidney inflammation that needed monitoring. My neighbor Carol, who has diabetes, regularly checks for protein in her urine to monitor for potential kidney damage, which is a common complication of diabetes. Glucose in the urine, glucosuria, can be a sign of diabetes or kidney problems. Rachel's urinalysis showed no glucose, which was a positive sign that her blood sugar levels were under control. My friend Jake, who was recently diagnosed with prediabetes, had glucose in his urine during his first urinalysis, which confirmed the need for lifestyle changes to prevent the progression to full-blown diabetes. Blood in the urine, hematuria, can indicate a UTI, kidney stones, or other issues. Rachel's urinalysis was clear of blood, indicating no immediate concerns. However, my cousin, who had been experiencing sharp back pain, discovered blood in his urine during a urinalysis, which led to the diagnosis of a kidney stone. After treatment, his symptoms and urinalysis results returned to normal. Leukocytes and nitrites in the urine can indicate a bacterial infection, such as a UTI. Mike's urinalysis showed no signs of infection, which was reassuring given his recent bout of illness. My friend Anna, however, had both leukocytes and nitrites in her urine, confirming a UTI, which was effectively treated with antibiotics. Making sense of your lab report, understanding the numbers. Interpreting a lab report involves understanding the reference ranges provided by the lab. These ranges represent what's considered normal for a healthy individual. However, it's important to remember that what's normal can vary based on factors like age, sex, and overall health. When Rachel received her lab report, she initially found the numbers confusing. Her doctor explained that while some of her results were slightly outside the normal range, they weren't cause for immediate concern. Instead, they provided valuable information for managing her health going forward. Similarly, when my father saw his cholesterol levels creeping up over the years, his doctor used the lab results to help him make informed decisions about diet and medication to reduce his risk of heart disease. If you ever receive lab results that you don't understand or that concern you, it's crucial to discuss them with your healthcare provider. They can help you interpret the results in the context of your overall health and guide you on any next steps, whether it's making lifestyle changes, monitoring certain levels, or starting treatment. Conclusion: taking control of your health with lab tests. Lab tests are a powerful tool for understanding your health, diagnosing conditions, and guiding treatment decisions. By learning what common lab tests measure and how to interpret your results, you can take an active role in managing your health and making informed decisions. Thank you for joining me on Health Square today. I hope this episode has provided you with valuable insights into understanding common lab tests and how to interpret your lab report. If you found this episode helpful, please subscribe, leave a review, and share it with anyone who might benefit. Remember, understanding your lab results is a key step in taking control of your health. Until next time, take care.